Welcome back to Therani, I'm Joe B. Today I'll show you the hip precautions that your patient needs to follow after an anterior hip replacement. Let's dive in. Hip precautions are normally prescribed and needed to adhere to for 6 weeks as it fosters proper healing of the surgery and reduction of hip joint dislocation. After an anterior approach total hip replacement, the patient is not allowed to perform hip hyperextension, hip abduction, or hip external rotation. In addition, the patient is asked to avoid active straight leg raise. The surgeon has the ultimate ability to wean patients sooner or later this time frame, and some surgeons may choose all of these precautions for patients to follow, or just some, or even none of it. The surgeon has the ultimate ability to wean patients sooner or later this protocol. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.